Yeah, in the last 2 decades, we've had less than 0.5% of people admitted to the hospital for any cardiac, stroke, vascular problem of any sort. And we're also in a place where, you know, we just don't see people die from heart attacks and strokes at all. So this is really a sea change for me personally, and I think the world.
Yeah, absolutely. You mentioned the world. You know, I mentioned in your introduction that a lot of doctors at your age are looking to wind down their practice, are looking to find somebody to replace them. You're actually looking for ways to have greater influence, and you recently started doing a telemedicine. Can you tell us a little bit about that and some of the experiences you're having?
We actually had a paper, we published it, but it began about 3.5 years ago when we found we could talk to people over the internet, give them information that would make it easy for them to do what we do now automatically. And that as they got incorporated it, their diabetes, which was terribly out of control, so much so that most of them couldn't work. They were unable to stay in any facilities very long because they just had to be admitted again. And when we took charge, put all this stuff in there, we didn't see anybody having a problem at all. They went back to work. They were able to do everything they wanted to do, and it was really a dramatic change. And the United States government has thought so too.
Really?
They've been seeing the paper that was just published this June.
Oh, that's fantastic. You mentioned new information that's coming out. General medical research is learning more and more about L-arginine and the importance of this amino acid. Are you seeing more research coming out as you do your studies as well?
Yes, and the interest is that we've really worked on the vascular component, the cardiac muscle component, and so forth. That was very exciting. But now we're talking about preventing sort of heart failure and the other thing, and anti-aging. And we're getting to a point where I find it's not uncommon for me to see someone get their last test done and say, "Congratulations, you can now stop all prescription medication."
That's fantastic. I want to put you on the spot a little bit, and I know that you're not a wizard or anything predicting the future, but I want to know, what do you see in the next 3 to 5 years for L-arginine and ProArgi-9? What do we expect to see from Synergy as well?
Well, most of everybody, as you go along with it, feel better. And around here, as I arrived today, we talked to lots of people that were so thankful that they could say they feel better, act better, and really are better. This is part of the anti-aging milieu. Now, it's easy to say that, and lots of people have websites involved with that. But it's different. It's a complete mindset different. You find you can do things that you haven't been able to do before. You're at the top of your game at a time, as you say, you'd usually be thinking of slowing down and I don't know what all. But I have enjoyed very much the opportunity to look forward to another 50 years of life as vigorous and everything as I'm doing right now.
You've spent your career as an endocrinologist, and you've worked with people who are suffering from diabetes and cardiovascular issues. But as you and I have talked offline, you talk a lot about other groups of people, such as athletes or younger people. Can you tell us a little bit more about who else is using these products besides those who are concerned about their cardiovascular?
It was 25 years ago when I began to see the first individuals who are actually high school athletes who said, you know, if I could raise my batting average a little bit more, steal a few bases, I might get a pretty good scholarship. I'm not a great baseball player, but I'm pretty good. And if I can augment my success, it would be useful. And it grew and grew and grew. And what has happened more recently, and you can't get any names, and they won't admit they're doing it, we see Olympic athletes now are coming and talking about it. And I make sure every year that I talk with the Olympic Committee, the people who decide what is good for people to take and not, to explain what we're doing. It could be nothing more just tragic if somebody suddenly found they were knocked off their gold medal because it was decided that what they did was not appropriate. It's not happening. And the most exciting time that I see that we're doing things is, first of all, in the Beijing Olympics, when the swimmers got in there, would win a gold, and then get out and just rest 45 minutes and get into the pool with people who had never swum yet and beat them.
Yeah.
That was astonishing.
It's amazing the recovery times that are improved.
Absolutely.
You know, it's really, it's quite eye-opening to find out that although we think a lot about cardiovascular disease, and it's a huge concern, obviously, worldwide, but L-arginine and ProArgi-9 is actually a product for everyone.
Sure is.
Everyone that we come in contact needs to be using this product. You know, one of the popular books amongst our Synergy family is a book called No More Heart Disease, written by Dr. Ignaro. And I was reading that recently, and there's a portion in that in which Dr. Ignaro talks a lot about antioxidants and the importance of using antioxidants with L-arginine. You actually have talked to me about that as well. What do you know about antioxidants and the importance in terms of cardiovascular?
Well, the big thing about it has been known for 25 years is that as you age, you oxidate a lot of things more. So if you put the antioxidants into your daily consumption, you begin the process of stopping the aging process. What we didn't realize was it would accelerate a lot of the benefits of it. And as I was saying just before we were meeting today, we had this situation where we could see in a lot of the clinics in Northern California that I work with and see everybody use the products. And we have a situation where you can see what you're doing exactly with the arginine and watch it bump another 5 to 10% with the oxidants, the Mystica.
That's incredible. You mentioned Mystica. It's an unbelievable antioxidant product. It continues to be Synergy's second best-selling product. And I think it's for exactly that reason you just talked about. You include Mystica in your supplementing process,
right,
and you actually see improved performance from your arginine. Is that correct?
Correct.
That's amazing. Along with that, you talk a lot about the immune system. That's one of the primary things that we can see improved when we use the Mystica. Tell us a little bit more about that and why it's so important to get that boost.
Well, we know there's a lot that the arginine itself does, but the Mystica was first brought to huge importance to me when a summer ago we were having 100,000 people a day, a week maybe, in London that were getting swine flu. It was really a big thing. And suddenly I got about 15 emails from the people who were involved in the business saying, you know, if you take 2 ounces of the Mystica daily for 3 days, you'll stop all symptoms. But don't quit. You take it 5 days and it won't come back. And that was so important for me personally, because as I was taking care of our share of that deal, we were able to really stop everything right in its track. Astounding that you all help every bit of the way.
So by introducing product high antioxidants with the L-arginine use, that's when we started to see that immune system really be able to fight
absolutely
back and get some huge results. I think that's vitally important. And then you also mentioned that it's such a great anti-aging product. What is aging, more or less? And when we talk about aging, what's going on in the body that's causing this aging?
Well, as many of you do testing on your patients, you see part of it. As you get older, the flexibility of the artery begins to disappear. Maybe the increase in the way you look at things within the framework of the testing also says you're slower and everything else such as that. There are 3 things you get out of the arginine in terms of anti-aging. First of all, as you know, and it was talked about in the video we just saw, the ability to change the lining of the cells, the endothelium, to make it back to normal and begin the process of getting rid of all the plaque that's in there, the cholesterol buildup and all. So there's number 1. And number 2 is that you get into this situation where that extends into the muscularis so that the muscle of the artery becomes softer, more flexible, and it too has a lot of things that have just been really changed. And lastly, you see the ability of the artery to return all the way to a 15-year-old. As you see the testing show, you're exactly testing like a 15-year-old, you know, the cholesterol's gone and the thallium's good, and you have the flexibility of a teen. It doesn't get any better than that.
That's absolutely true. Well, I appreciate your comments on that because I think that's been so important, and it will be a big part of us moving forward. So, ProArgi-9, including that in our day-to-day supplementing process, including a product high in antioxidants, Mystica being a product that tastes great, is easy to consume, and tests very well for the antioxidant products.
And don't forget what John Hewlett gave me, that 15, now 45-page thing from Harvard that says if you take enough arginine, you won't get Alzheimer's.
Interesting. So we continue to see new research in terms of the arginine and its effect on not only your cardiovascular system, but on the brain and other parts of the body. Is that right?
The whole thing.
The whole thing. The whole body benefits from L-arginine.
That's anti-aging.
That's anti-aging. And
way back in about 1970, I was working at University of California, San Francisco, and we found that in people who had what's called the short bowel syndrome, in other words, only about that much to absorb everything you need, couldn't get enough D. They couldn't. They would die if they couldn't do something else. We eventually figured out a spray D would be very good. So we began to put that together, and that's one thing. But the most important thing is you recognize, how does it get into the body? And something that is something you can hold in your mouth is the best thing. So to be able to just on the fly take this, take it to work every day so that you could put something like I didn't do when I was here on Monday, not here on Monday, but on Monday when I got the first cold since the 6th grade. If I would carried it with me or even thought about it, I probably would have aborted the cold and have my voice today. But this is the kind of thing where it enables somebody to say, okay, I know the best, fastest way to get in is to hold this in my mouth. You can chew it, make it something that's more amenable to going into the buccal mucosa, which is inside of all the cheek, under the tongue and on top of the mouth. And this makes it fast. It makes it something you absorb more, because if you take a capsule, in the main what you do is only absorb 1%. That's not so much. And it takes a long while for it to get to the 200-day period when you actually get enough. The
conundrum is kind of interesting. We were talking about it earlier. We have been taught and are getting so good at staying out of the sun and using sunscreen, but it is the sun that typically provides us our D3. Is that right? How does that work?
Well, you get vitamin D mainly in the United States and most places from fatty fish, salmon and things like that. So most people have to be supplemented. With today's understanding, you've got to take more than you can get from food. It's too important. You're preventing cancer, you're making everything we're talking about today and the vascular system better. So you know you've got to do it right. So when you get into a situation where you can put these things in here and speed up all we learned from 1922 when vitamin D got the Nobel Prize up to this past week when we've seen about 10 new articles on what it will do for everybody, you realize this is very important. And I'm involved in a lot of other research studies that over the next year or two you'll see way more things that you're really going to say, boy, I'm really glad I'm taking the whole amount you gave me.
Correct. That's about 12,000 IUs right there. So, who should be taking vitamin D?
Everybody. Everybody, without question.
Without question. So this is good for young adults, older folks.
Yeah. Well,
as you get older, do you need more?
A lot of the information and the Vitamin D Council, which I know many people are involved with getting, is about how you don't have autism with using lots of vitamin D. You should begin in pregnancy. And then as the child is born, there's a lot of reason to think you should know what that's all about and get them a little bit of it too.
Excellent.
Very good.
And so we're seeing vitamin D or lack of vitamin D linked to what types of diseases? What do you see typically?
A lot of things we don't really think about. fractures that are sort of unusual. They've described